My name is Kaushalya and today's presenting topic is tobacco de-addiction under the guidance of Dr. Manu Parmar sir, Professor and Head of Department of Psychiatry. Tobacco is contains the nicotine. It's a highly addictive substance. It's consumed by smoking and smokeless form. In smoking is cigarette, bidi and hookahs, and smokeless form are gutka, pan masala and kheni. It's affecting multiple systems and also lead cancer, cardiovascular disease, respiratory disease, and reproductive issue. Its nicotine addiction is developed due to stimulation of dopamine reward pathway in the brain. In epidemiology of tobacco, 1.3 billion people are worldwide using the tobacco. The mortality rate is 8 million in the worldwide, and in India it's 1.3 million. Most common is in India is smokeless form. In the India is 28.6 is adult using the tobacco. In the male is 42% are male and 14% are females. High prevalence state are Mizoram and Nagaland, and low prevalence state are Kerala and Goa. 14% of all kills cancer are related to tobacco. These factors: low education, peer pressure in youth, low socioeconomic status, availability in cheap form, aggressive marketing and cultural acceptance, impact in the health problem, in the health public health, increase the burden of cancer, COPD, cardiovascular disease and stroke. Further topic is explained by my colleagues.
Thank you, Dr. Kausalya.
Good afternoon, everyone. I am explaining the tobacco cessation. There are 5 A's and 5 R's in tobacco cessation. In 5 A's, which included when patient is ready to quit the tobacco, and 5 R's are applied when patient is not ready to quit the tobacco.
Right.
In 5 A's, first is ask. Ask the patient that that he tried to quit the tobacco or not. In advice, we advise the patient to quit the tobacco. In assess, we willing the tobacco quit and assist. We will assist the patient to quit the tobacco, and in arrange, we will arrange the follow-ups. In 5 R's, the first is for relevance. In relevance, we will explain the relevance of tobacco to the patient, that how the tobacco will affect his health, his family's health and his financial condition. In risk, how the tobacco will produce the risk factor in the patients, that it will produce the coronary heart disease and many other diseases. The third one is for rewards. We will explain the benefits of quit after the patient will quit the tobacco, that how it will improve his life and his family's life. In roadblocks, we will assessment by counseling the patient, that why patient is not ready to quit the tobacco, and we will manage it by counseling. And in the repetition, we will repeat these 4 criteria at every follow-ups. Now further will be explained by my colleague.
Thank you, Bhargav.
Good afternoon everyone, myself Biren Patel, and I am going to talk about the strategies for tobacco cessation.
Right.
There are 2 types of strategies. First, behavioral interventions and the medical treatment. In behavioral interventions, first of all we do the motivational interviewing, counseling, behavioral therapy and setting up quitting date and avoiding triggers, support from family and friends. After that we go to the medicinal therapy, pharmacotherapy. There are 2 types of drugs, first line drugs and second line drugs. First of all, we start with nicotine replacement therapy. Helps to reduce withdrawal by giving small controlled nicotine doses. Forms include nicotine gums, patches, lozenges, inhalers and nasal sprays. Dosing depends on how much the patient smokes. Next we go with non-nicotine medications. These are bupropion, atypical antidepressant that decreases the craving for nicotine. Then varenicline, partial nicotine receptor and agonist, reduces craving and pleasure. After that, if the first line drugs fail, we go for second line drugs. There are norepinephrine and clonidine. I thank Manu Parmar sir for such an opportunity to present a very useful and such a big problem in society. Thank you, sir.
Okay, thank you, Biren.